Hi everyone, good morning, good afternoon, wherever you're joining us from. It's really nice to welcome you to our MSc Occupational Therapy pre-registration webinar today. We are joined by Laura Hall and Ro Harrison at the moment, who Laura is currently the Year 1 coordinator on the programme. So she'll be able to give you lots of advice and guidance about starting the course. Ro is also going to be taking over as Year 1 coordinator for the next intake, so she will be able to do the same. And we'll shortly be joined by Chris McMahon, who's the admissions tutor for MSc Occupational Therapy pre-reg. So you've got a plethora of experienced individuals who you can benefit from today. So I will, without further ado, hand over to Laura. Please feel free to ask any questions in the chat box to your right-hand side, and we'll do our best to answer them throughout, okay? Enjoy.
Thanks, Hannah. Can I just check, are the slides visible for everyone? Yep. Fab. Yeah, so welcome everyone. As Hannah says, my name's Laura Hall and I'm currently the Year 1 coordinator for our master's programme. So within the programme, we have the programme leader who oversees the whole programme, and then each year we have a specific coordinator who's just that extra point of contact for students to help kind of guide and support through that stage of the programme. So at the moment I'm in that role as Year 1 coordinator. When Ro takes over that from me in January, I will actually be moving into the programme leader role. So we'll still be very heavily involved with the master's programme, just in a slightly different way from January. So, but right now I'm still the Year 1 coordinator, so I'm going to take you through a bit of information about what you could expect from Year 1 of our programme. And just to say, I imagine that who we've got here today might be a wee mix of students who know that they're coming to join us in January, are quite sort of set on that decision, or just here for a bit more information. But equally, there might be some people who are maybe still kind of making decisions about whether or not to come to GCU. But I'm hoping that kind of regardless of the position that you're in, that this might be really helpful information about what Year 1 might look like, and what some ideas about the programme to help then inform your thinking about starting the programme in January. And I see Chris has joined us as well, so welcome, Chris.
Hi everyone. Hi.
So yes, I'll probably cover that, but welcome. Nice to see lots of people here, so welcome to the session. So we'll start off just with a bit about who am I. I think it's always nice when you're thinking about embarking on a kind of new stage in life to have a bit of an idea of who you might be working with when you're going to be making that decision. So I'm an occupational therapist. I actually completed the master's pre-registration in occupational therapy at Glasgow Caledonian University, as did Ro. So we've got two kind of graduates from the programme who have come back to work at the university and be part of it. So hopefully that just in itself gives a bit of a positive sense of our experiences of the programme, the fact that we've come back to work here. So the top middle picture you can see there is our campus at Glasgow Caledonian University on a much sunnier day than we have today. I have to say, it's absolutely torrential rain in Glasgow here at the moment. So I completed that programme over 10 years ago, let's say that. And after that, I went on to work in a range of different settings. So I started out in hospital settings and worked through a number of different services there. So worked in like medical wards, older adult rehabilitation, stroke rehabilitation, hand therapy, number of different settings before moving out to the community. So the picture from on the right-hand side there is a Glasgow tenement building where lots of flats, quite a typical building in Glasgow. So moved out to the community, so much more going out to visit people in their own homes, to work with them there in buildings similar to that. And I specialise predominantly in working with older adults, people with dementia, was my main area of specialty in the end. And so my most recent job was in an older adult community mental health team. So that's just a little bit about me and my background. And then I joined GCU around 4 years ago. So I've been lecturing here for about 4 years. So I'll tell you a little bit about the role of Year 1 coordinator, which is that role that I'm currently in. So it's all about supporting the MSc programme leader, who is kind of responsible for that overall sort of health of the programme, but really to try and support students through the process of joining the programme, going through that induction process, really being that point of contact for students, because I think it is really important that you know that there is support available if issues arrive, So that is very much something that we try and do is provide that support for our students. Generally just kind of involved in trying to work to make sure things go as smoothly as they can across the first year of the programme, make sure students understand what to expect, what's going to be happening. So what we're doing today is almost a little taster of what it is that we do once you're with us. Within the role of Year 1 coordinator, I'm also often involved in organising additional kind of support sessions that students might need. So whether that's from the library on kind of accessing appropriate literature, or we've got a really fantastic learning development centre within the school at GCU who provide a lot of additional support with academic writing and particularly that kind of step up to master's level writing. So we often arrange additional sessions with them to support our students to really feel prepared for the demands of the programme. But we really base that on whatever it is that the students that we have at that point in time need. So we often tailor the sessions we're organising just to kind of match what it is that we think students might benefit from at that point in time. And something that we're quite heavily involved in, and apologies, the contrast of colour on that slide's not come up as it was on my screen, so that's maybe difficult to read, but I will talk you through it. But something else as the Year 1 coordinator that I'm generally really involved in is just making sure students have the information they need before starting the programme, because that's really important as well. I think, starting a master's is a big decision to make, a big sort of change in life, depending where you're coming from. If you've been in an undergraduate programme or maybe in employment for some time, starting a master's is a big thing. But particularly coming to a programme like this, where we are preparing you to become a health professional who is eligible for registration with a professional body, there's quite a lot that we need to kind of tick off in that. So we'll make sure that you have all the information you need. Some of that comes centrally from the university and some of it is organised more by ourselves within the OT team. So things like timetables, there's health screening that has to be carried out, visa for international students who might require student visas to come to the UK, registration information, and also you will require uniforms, student uniforms when you go out in placement. So there'll be lots of information comes out before starting the programme about accessing those different kind of requirements. We'll also share information with you about joining the Protection of Vulnerable Groups scheme, which is like the sort of police check that's required before you can go out on placement. We'll provide information on things like fitness to practice. But we also set up like a Facebook group for students before they start, so that before you actually join us in January, you've got a chance to connect with other students who are planning to come. But we also we invite some of our current students to join that Facebook group, so that there are students there that you can actually ask questions to and make contact with to get a bit of that support before you actually join us in Glasgow for the start of the programme. And we provide you with a lot of information as well about Induction Week and what you can expect from that, because I'll go on to tell you a bit more about Induction Week shortly, but we do set that up to try and really introduce students to the programme and be prepared for what's to come. So we'll get information out to you in advance about what to expect from that as well. And so that induction to the programme, that is, we have an induction week that runs from the 22nd to the 26th of January 2024, and it is all about trying to kind of prepare students for starting the programme. So we'll send out relevant information and timetables to you before that. But that week, the sessions that we organise, it's all about trying to introduce students to GCU. You may have studied at different institutions from across the world, and I've seen a bit in the chat that we've got people internationally joining us today, which is fantastic. But it does mean, we really recognise that we've got people coming from different backgrounds, different educational experiences. So we use that induction week to really try and kind of bring everyone together, start getting to know people, start getting to know the team, and just get familiar with what to expect from studying at GCU as well. So you get to meet some key members of the team. Some of us are here today, but there are others that you get to meet in that induction week. And we use that time as well just to really outline the expectations of studying at master's level, helping get students ready for potentially that step up from what you might have done at your undergraduate degree. Introducing some key information as well. There are some key kind of policies and standards that are important to know about as you prepare to join the profession of occupational therapy and joining the university itself. And very much about giving students a chance to start getting to know each other and settle into the programme as well. We do try and allow time for that, just building connections and making friends, because we do recognise how important that is as part of an educational experience, and those friends that you can make in a programme like this can often be friends for life. So we do try and kind of get off to a good start with that as well in our induction week. And just to give you a bit of an overview of what the first year of the programme actually looks like. So at GCU, we talk about trimesters. So sometimes you hear more semesters. We have 3 trimesters across the academic year. So we do break that down. Ever so slightly confusing. We start slightly out of sync with the rest of the university. So we start in trimester B with the start of our master's programme. But you very quickly get used to that slightly different way of working that. So we start in trimester B, and that is January. So it would be January 2024 that you'd be hopefully starting the modules that run then. So there are 3 academic modules that run in that first trimester. They're all about giving you that real kind of introduction to core knowledge and skills required for practicing as an occupational therapist. So you've got the module Essential Practice Skills for Occupation Focused Practice, which is all about introducing those kind of key foundational skills, quite practical skills, understanding the processes that occupational therapists have to engage in when working with clients. So that's all about that sort of real practical side of the skills we're looking at. Then there's the module Foundations of Occupational Therapy and Occupational Science, which is a bit more of that kind of theoretical underpinning, but really important information to understand kind of how humans engage in occupation and how what that might look like, and understanding that on a deeper level comes from a lot of that foundational theory that's introduced in that module. And then there's occupational performance, body structure, function, and participation. And that one is where you get a lot of your anatomy, physiology, and you learn about different health conditions and what it is that occupational therapists need to think about when working with people with those different health conditions. And we know that we get students coming from a range of different undergraduate degree backgrounds. So some have quite a bit of that anatomy and physiology knowledge, but a lot of us don't. I personally had studied engineering before coming to the master's degree, so I learned a lot of that anatomy and physiology when I came to do the master's. So it is designed to bring everybody to the level that's required for occupational therapy practice. So not something to be off-putting if that's not the background that you have, because we do help to get you to that level. So that's your first trimester, is all that kind of academic modules, really giving you those foundational sort of knowledge and skills that are needed before you go into your second trimester, where you go out on placement. So that one runs over our summer, so kind of May to August time. It's a 7-week placement that runs, we call Practice-Based Learning 1. So it's your first of 4 placement modules that take place across the 2 years of the programme. So I will go on to talk a little bit about placement in a moment, but that is really where you actually go out to apply some of that knowledge from your first trimester by going out to work with an occupational therapist in a health or care setting. And then your final trimester of your first year of the programme, you have another placement, but you also have a couple of academic modules there. So our current year 1 students are just starting these modules this week, in fact. So the first one is evidence-informed occupational transformation. So that's where you start to learn a little bit more theory, building on what you've previously learned, but really to help develop your professional reasoning. So that's your ability to sort of think and make decisions like an occupational therapist. So gaining lots of information on how to really make a difference in people's lives. So that what we're calling, it's called occupational transformation in the module title there. That's all about really transforming and changing people's lives through use of occupation. So that's a really interesting module that you get to undertake in that trimester, alongside interprofessional working, context, organisations and practice, which Chris that's with us today knows very well. He's the module leader for that one. So that's one where you actually get to work alongside colleagues or students from other professions, so like physiotherapy, nursing, social work, I believe, students who are on that module. So you get to develop some core skills that are required for healthcare practice, but alongside other healthcare students, and also learn a bit about their different roles, which is really important for going out. Oh yes, Chris, sorry, do you want to come in and correct me on something about your module?
No, I was actually just thinking, do you want me to speak to this? And
yes, certainly. Do you want to? Yeah, absolutely. Since you're here, yes.
Yeah, absolutely. May as well put me to work, Laura.
Thank you.
Yeah, nothing. Everything you said is absolutely 100% accurate. We also have radiographers on the module, and essentially what IPE does is learn things that you would essentially have to learn on your own module anyway. So you learn about leadership, you learn about organisational culture, you learn about change management, all of those things. But as Laura said, you learn them with your colleagues who are going to be your future multidisciplinary team, your interprofessional team. And what that does is that has the benefit of then helping you to understand their role. And when you understand their role better, you also understand your own role better, because you understand where your professional boundaries end and their start. And there's lots of really strong evidence about interprofessional work, most importantly, being really effective for clients, patients, service users. But it's also really important for your quality of life. If you have good relationships with your colleagues and you're not overstepping your boundaries, and you know who to refer on to appropriately, then it makes your job an awful lot easier. So we have a kind of really innovative assessment for that, which is our TOSPI, which stands for Team Observed Structured Professional Encounter. And essentially what that is, it's like your own interprofessional team meeting. So you have a case study, and you work on that case study to come up with a plan. But it's really more about how well you communicate, how well you understand each other's roles, how well you problem solve. So it's actually a kind of a really practical assessment, and that's and the other components is an essay. But yeah, it's a really, really good module, and I'm just kind of sure you'll enjoy it. But I am ever so slightly biased, so I understand that. So you should take what I say with a pinch of salt. But
Thank you for acknowledging that, though, Chris. That's very fair of you. Yes. No, thanks very much. So. And then the final module in year 1 is your practice-based learning 2, which is an additional placement module where you get to again kind of take forward that knowledge that you're building out to a different practice setting from where you were in practice-based learning 1, to sort of learn a bit more about occupational therapy practice and across different settings. So that was very nice, actually, Chris, you taking over there, because it let me just get a bit of a moment to scan over the chat as well. It's lovely to see people popping in where they're from, which is great. We've got people from a number of different continents, I think, at the moment, which is really fantastic to see. So, and if you've got any questions as we go along, please do just pop them in the chat there, and either we'll answer them as we go along, or we'll come back to them at the end and have some discussion just to hopefully clarify anything that you're hoping to get a bit more information on. So, but hopefully that's been useful just to get a bit of a sense of what that first year of the programme looks like. You then do go into a second year where there are some additional academic modules and 2 further placements, and the dissertation that takes place in second year of the programme as well. But for today, we're really just kind of focusing on year 1, so as not to potentially overwhelm too much, but just to give you a taster of what's to come. But hopefully that gives you a sense of the sort of real diversity of experiences that you might have in your first year of the programme. Oh, and I see somebody's just popped that they've lost sound and image. Hopefully that's, am I still coming through to you okay, Chris and Rose, since I can see both of you? Yeah, but it's possibly just Ear to herself that's having some issues. I will carry on and hope that she's able to recover that. So I have mentioned I'm going to talk a little bit about placement. So without further ado, we're going to go on to that. So what we refer to as practice-based learning, and this is often the part of the programme that students get particularly excited about the opportunities for. And what we're really, really fortunate to have at GCU is a real diverse range of placement experiences available to our students. So we get students going on placement across Scotland, and we get some really fantastic opportunities. So the map of Scotland in the middle, we are kind of over at the left-hand side of the dark blue bit in the centre there. But you can see that there are a range of areas across Scotland, and we do get some really great opportunities down in the borders, down the greener bit at the bottom, as well as up into the Highlands and Islands as well, up off the north of Scotland. And we get some really positive feedback from students getting to go to different places, experience working in different settings, maybe in more rural settings for one placement, more city-based settings for others. And that can be across hospitals, community settings, but also across a range of what we call third sector organisations, so like charities and different organisations like that. So you can see just a selection of them represented by the icons on screen there. So we've got some really fantastic partnerships with a range of different organisations where students have been able to go and work. And we've had some students doing placements with the Scottish Fire and Rescue Service, and we do some joint working with them throughout the Masters programme. But other organisations like Scottish Refugee Council, Alzheimer's Scotland, a number of charities that are kind of local to Scotland, and we've also had some opportunities in recent years for more international placements. During COVID, we had students doing an online remote placement in Fiji through Think Pacific, which is identified down at the bottom, which is really fantastic opportunity. And the one slightly to the left of that, which is Bounce Tea, is actually a social enterprise that's been set up as an occupational therapy organisation by a graduate of occupational therapy at GCU, who set up this really fantastic organisation providing support and services for children through kind of bounce therapy essentially. So, but they provide a lot of services. So we've got a range, and there's a whole lot more that I couldn't have fitted onto one slide, but really great range of experiences. And as I said before, you get 4 placements across the programme, so 4 opportunities to go. And what we do try and ensure for each individual student is that you get a real diversity of placement experiences, so across different settings, different client groups, different ways of working. So perhaps working quite a fast-paced hospital ward for one placement, but then something maybe out in the community where it's a bit slower paced, a bit more in depth, spending more time working on a longer term basis with patients for another opportunity, so that you get that real diversity and range of experiences. Something else that the two that are on camera joining me will probably laugh as I start to go into this, because I do never miss an opportunity to plug this, but we also have an occupational therapy blog, which is less related to year one, but it's related to me. It's something that I kind of run and organise, is our blog. So hopefully some of you might have already seen it, but if not, I would really recommend that you access it, and you can sign up to actually receive the weekly blog posts into your mailbox. So the QR code or the link over on the right hand side there will help you be able to do that. But this is something that's been running for a number of years now. And so our blog is used to share posts with stories from our students, from staff, and from practitioners. Initially, it was across Scotland, but actually we're now getting posts being shared more internationally from occupational therapists working in different settings. And the blog is all about kind of sharing learning and celebrating success across the occupational therapy community from education and practice. So it's a really good way of seeing a little bit more of what's going on in a range of different settings, as well as what's going on for us at GCU. So we'd recommend you go on and have a look. And we've had some really interesting posts recently, and setting up some series of posts as well that are sharing some sort of maybe thought-provoking or interesting ideas around the profession of occupational therapy. So well worth having a look at that as well when you get the chance.
Laura, sorry,
Yep.
I think you maybe thought it was a legacy hand.
Oh, I did. Sorry, I didn't.
No, you're okay. You're okay.
It was
just in terms of to say to students about placement, in terms of we offer the opportunity for students in the final placement to kind of go closer to home, which is really, really helpful, because quite often what you'll find is your final placement, a lot of people get their job from their final placement. You know, if you think about your final placement, at that point, you're working at the level of, by the end of the placement, you're working at the level of a qualified occupational therapist. So if they see you and you're functioning well, quite often people get jobs almost kind of directly from that. So we do offer the opportunity for you to go, if you are from slightly further afield, to go closer to home and kind of take advantage of that essentially. So that's kind of one of the kind of real strengths of our programme as well. That was all it was.
No, you're quite right. Sorry, Chris, I had forgotten to highlight that as well. So absolutely, that opportunity that there is, which can be really valuable for a lot of students. So thank you. Yes. And we'll skip back. Now, this is really just because quite often when students get in touch with me before starting the programme, this is often a question that's asked. So I've just popped this in just to give you a bit of an idea, because usually students want to know what are the textbooks that they're required to buy for starting the programme. So this is really just if you're one of those people that likes to be organised and on it, this is hopefully just to give you that bit of information. But essentially, there are no absolutely required textbooks that you need to buy, because we use a range of books from across different kind of areas of occupational therapy and occupational science. So what we do have is a list of recommended books. Apologies, my slides have kind of got a bit squished in the whatever the format is for this. So my crosses and ticks at the right-hand side aren't quite lining up the way they were meant to. But what I've provided here is just a list of our kind of recommended books. Students are not required to buy any of them. It's just to give a bit of guidance, but some students I know do like to access some core textbooks in advance. So there are a number of them, which is really just because we do draw on that range of literature to inform our programme as best we can. And what is meant to be my crosses and ticks over on the right-hand side, hopefully you can work out the alignment, is just to let you know whether it's available as an ebook through our library, because that can often inform students' decisions on what they might prefer to buy or not buy. But these books will be drawn on across different modules at different points in time, depending on what it is that you're learning in those specific modules. So if this is something that you're interested in, you can maybe just take a quick shot. I know this session is being recorded as well, but if you want to take a wee shot of that slide, that might just help you to have that information available to you. But you're not required to buy any of them. We do try and make sure if they're not available as an ebook, they're available as a hard copy book within our library at the university. So, you don't have to purchase any of them yourself if you're happy just to access them through the library service. Okay, I'm hoping if any was taking a wee shot that you've had the chance by now. So that's really all the kind of information that I was wanting to kind of share with you. And hopefully that's given you a useful sense of where we're at. I have popped my contact details up there, so you can contact me by email, or I've left it as a Twitter icon. I realise I probably should have changed it to X, but I'm not quite ready to make that transition yet. So I've left it as the Twitter icon. So do use Twitter. So you can use either option for getting in touch with me, if that would be helpful for you, if you'd like to know a little bit more about what we've talked about today. But really open to any questions, anything that MD would like more information on. So I think I did see one popping up. So I don't know, Chris or Ro, if you've seen any questions coming in, but I'm going to...
There was one question that came in, but I kind of responded to it from Arjun. So I responded. The question was about if you can work internationally, if you complete our degree, and basically what I said was that we're with it accredited, so the World Federation of Occupational Therapists, we're accredited by them. Some countries have some additional requirements, but we would support you with those because so when we have experience of supporting students with additional criteria. But yes, in terms of we're with it accredited, which is the kind of World Federation. So yes, you can essentially work anywhere.
We have a lot of students that go on to do that. And then what we also have is those students that have gone on to do that often come back to support our current students with going through that process. So, for example, we have a number of graduates who are working in Canada who will then come back to maybe, deliver a session similar to this, but for our current students who are looking to get registered in Canada, so to kind of share some of that advice and guidance. So we're kind of building up that network as well to support our students with that process of taking their qualification from here out to work internationally as well. I see Alison's popped a question in about the exact term date. So I have just pulled across the academic calendar for the university. So I'm just going to pop that in the chat there in response. So that is just the sort of general university calendar. So you will see that it does start from trimester A, which is just now. We're in week 1 of what's trimester A, but this programme would start in trimester B. So the dates for January and beyond are listed on that website there that you can access. So you've got at least a sort of guide of the dates, but we give you more specifics on that kind of near the start of what it actually means for our programme near the time of joining us in January. So
it's usually the last week in January, isn't it, Laura? It's usually the last week. So obviously that moves around with the calendar. But
yes, sort of varies a little every year, but yeah, there's some consistency. So yeah, hopefully that gives you a starting point at least, and then yeah, if you're joining us in January, myself and Ro will send out kind of more clarity on that nearer the time, but hopefully it gives you a start. So fab. Any more questions that anybody would like to know a little bit more about? Hopefully that's helpful, just to give you a bit of a sense of what to expect from joining us. And certainly if you're joining us, it'll be myself and Ro that you'll be meeting on day one in induction week in January. So we will very much look forward to meeting all our students joining us then. So hopefully, I think it's often nice just to know you've seen a couple of faces to match up to who you can expect to. And it often surprises me actually, having done something similar to this like last year, and then in January people coming in and like, oh yeah, I remember you, and it's and I'm thinking, how do they know me? But it's from this. So hopefully, if you come, you will remember and be able to do the same thing and equally confuse me in January.
I think even just the simple thing of popping your head in the class and seeing a familiar face and realising, oh, I'm in the right place. I haven't got lost.
Yeah, exactly.
So yeah, I think it's a really nice thing. Yeah,
it does. Yeah, it does make a difference. All right, unless I'm missing anything, I'm not seeing any more questions coming in, which is absolutely fine if that's hopefully giving people the information that they're looking for. But happy to give it a few minutes if anybody's formulating a question or typing anything out. But I think
you've been so thorough, Laura.
Oh, I know I must have been.
So thorough that you've thundered me into silence. That's what it is.
Yeah, no, I'm going to take it as that rather than anything else.
You're welcome, everyone. You're welcome, Alison. Yep.
Yeah, great. All right, but as you've got my contact details there if there is anything, and there's also the inquiries line. If it's something more specific about the admissions process or kind of finance side of it or anything at all like that, we want to go through the inquiries desk as well for that. So we do have the email address for that we can pop in the chat. I'm not sure if we've hang on. Let me just get that ready to copy over. So if you do have queries, because often something can come to you afterwards and you think I should have asked that, so then at least if you've got some contact details, then you know how to find out the answer to your question that you might have. So but yeah, no, thanks very much for joining us. I'm going to say this afternoon, but I actually appreciate that for most of you, from seeing the variation in locations that we've got for people, it's not necessarily afternoon for that many of you. Oh, thanks, Ro, yeah. So yes, nice to see lots of you here today. I'll go for, since it's not necessarily afternoon for all of us. Hopefully that's been helpful. And I really hope that we'll be seeing you come January, that you'll be joining us when we start the programme in January 24. So yeah, thanks very much. And unless Chris or Ro, anything to add, I think we can...
No, just looking forward to seeing you next year. And 2 years, accelerated masters, it will absolutely fly past, and I'm absolutely sure you'll. For those of you that aren't from Glasgow or have never been to Glasgow, you'll love Glasgow. It's a fantastic city. GCU is a fantastic university, and I think we've got an excellent programme. So I'm sure you won't regret it. Although I didn't do my MSc at Glasgow Caledonian, I'm also a graduate, so I studied my BSc because there was no MSc in Occupational Therapy at that time. So I'm also a graduate from GCU, and I came back to, so that we have a full house.
A full house, yeah.
Of GCU graduates who, but it was so good that they came back to work there. So looking forward to seeing you all, and looking forward to getting to know you and working with you. Because I'm involved in the foundations module, so I will see you in the first trimester, Foundations of Occupational Therapy and Occupational Science. But yeah, looking forward to seeing you.
Yep. Likewise, thank you so much for joining us. We hope to see you in January and for the potential class of 2026. I know it's really not that far away. I'll also see you in the first trimester as well. I'm part of the Occupational Performance module, the one that Laura mentioned in terms of anatomy. So I look forward to seeing those of you that join us then. But yes, GCU is a very welcoming university to be part of.
And what you've Rose certainly said there is you're going to be successful because she's already said that you're the part of the class that graduates in 2026. So you're coming into that optimistic, environment. So yeah.
Already planning the celebration for your graduation. Yeah, why not? Fab. No, thanks very much for joining us, everyone. So yeah, look forward to seeing you soon, and do get in touch if you've got any questions. Thank you very much. All right, we'll sign off there then, I think.
Bye, everyone. Bye.
Thank you. Bye-bye.
Thanks very much. Bye.